Welcome friends, this is Dr. Indu Arneja from Master's Stroke. Continuing with the initiation that we have taken to interview medical professionals on a very important topic, very dear to my heart, that's doctor-patient communication and relationship between the two parties, that is healthcare professionals and the patient party. Today I have with me a very eminent personality, Dr. Shakti Kumar Gupta. He is Medical Superintendent, All India Medical Institute of Sciences, RP Center. Sir, it's a pleasure having you on this platform. It's actually an honor to have you here. But we have taken an initiative where we are trying to bring in senior people to come and talk about the major problem we are experiencing on the front of doctor-patient relationship. So I feel as a very senior faculty in this field, you will be able to share the story of your side, the kind of challenges our young doctors or senior doctors are facing. And also, you'll be able to send a message across to medical fraternity that we have a responsibility to take. Things are changing, so do we need to upgrade our skills and meet the needs of the society. And doctors we know are very well educated, so for them picking this would not be a problem. Only thing is realization that what is the need of the hour, that's probably we need to kind of address. So I hope with this program we will be able to serve both the parties, society as well as our medical field. Welcome, sir. So before I start with the discussion, would you like to say something for the program or for the initiative?
I think this is a very good initiative which we have taken. Actually, I must congratulate you. I think this is a very important topic actually, that is a soft skill and communication, whether they're for the doctors, nurses, technicians, or anybody actually who is associated in providing the healthcare. Even for the hospital administrators, actually, how they communicate to the patients, to the users, or unfortunately we know say that customers. So which usually I hate actually using the word customer actually. So this is a big challenge before the providers as well as the seekers of healthcare. Actually. For both actually this is a big challenge how to avail the facilities which are available over there actually, and how we can optimize and utilize that.
That's so true. Sir, कितने साल हो गए होंगे आपको?
I am in a medical profession for last 38 years.
Oh my goodness.
But
so,
in AIIMSS Institute of Medical Sciences for last 25 years.
So you are an institution in yourself, I would say.
I feel lucky that I got the opportunity to work in a dispensary, then primary health center, a district hospital. I worked in a directorate of health services also in J&K. I have worked in a medical officer in ICDS also.
Wow.
Then actually I got opportunity to work in the medical college as a deputy medical superintendent before shifting to AIIMSS actually in the year 1993.
Oh my goodness, quite a time.
So I feel lucky that I got the opportunity working at all levels of healthcare provision.
So you can actually relate with every place of work. Yes. And the kind of challenges that they are facing. So having this 38-40 years of experience, do you feel any change in the relationship that you enjoyed with the patient or their family, and what is the situation now?
Yeah, definitely actually there are changes there actually, but I have enjoyed actually where I have worked. Whether I have worked in the dispensary level, I used to have a really good number of patients, about 100-150 a day.
Oh my goodness.
And I never had any problem in spite of that medicines were not there, no lab tests were there, no x-ray, but the most important is that at all levels, how much time we spend with the patient, that is very important. You know, when patient visit to the hospitals, we are grateful to the patient actually, because he gives an opportunity to serve to him. You imagine a scenario that there is no patient, then why I am not required, doctors are not required, nurses are not required actually.
I know.
If we are there, it is all because of the patient, and we are grateful to the patient. Whenever actually my students join in my department or in All India Institute of Medical Sciences, my first message to the doctors and especially to the residents of Department of Hospital Medicine is that we should not grumble that we get large number of patients.
Yeah, so true.
If large number of patients come to you, it means they have a trust, they have a confidence on your hospital, they have trust and confidence on doctors, nurses, and all those who are associated in providing the patient care. I think that is more important actually. So we should be grateful rather than always grumbling that we have got a large number of patients coming to us.
Yeah, at times when I conduct training programs, I do get to hear from the doctors, especially working in government sector, that man, you have no idea the number of patients we see, you come and see the OPD, how overworked we are. And then I just ask them to stop and just think of the doctors who are getting their qualification or education from the private medical colleges, where they have everything, but there are not many patients.
Yes.
So all your experience and expertise you get by working with the patient. So I think people who are actually working in such setup should feel blessed. And again, it's how you want to look at this situation.
I think actually we must actually see that actually how the patient, like in AIIMS, as on today, 15 to 16,000 patients are coming in the OPD, and 60% patients are from outside Delhi. Now these are patients who come from northeast, neighboring states, and neighboring countries also. So when they come to us, so everybody is not that rich actually. They take a loan, they sell their cattle, they sell their assets also, and then they come to AIIMSS of Medical Sciences with a hope that they will get the appropriate advice and treatment, and that too a quality and safe treatment actually. So with each patient there will be 1 or 2 patient attendants. So if you come to AIIMS actually even early hours in the morning, maybe at 3-4, actually you will find a queue over there actually.
Oh my goodness.
Because they keep on waiting during the night so that they get registered
at the earliest in the morning.
At the earliest in the morning, so that they get access to the doctor. And when these people they come, we must appreciate that how much time they have spent in coming to the doctor. Definitely, I agree that there is a long queue actually, maybe for registration, then waiting before going to the doctors, and then what happens actually, doctors actually they are not able to give that much time because number is too much, and then actually they have a lot of expectation when the doctor actually is not able to give that much time, because patient wants to know his story, what is the problem for which he has come, and then doctor should listen. So I feel that the doctor should be a good listener. At least let the patient speak actually what is the problem actually. Only then he will have a confidence, because very few minutes when a patient spends with the doctor or a doctor spends with the patient, that is a very crucial, where actually a doctor will be able to understand the patient, and a patient will actually be able to convey what he feels. After all, he has come from spending a lot of money. You will be surprised that in our country 76% of OPD patients they spend out of pocket, and every year more than 1 crore patients they become poor because of the expenditure.
Yeah, I know. I was reading this news just yesterday. I was reading this, and it's a very sad story actually.
So when we talk to the doctors, they say that large number of patients are there. We are not able to give that much time. But I think what is required actually, we must have a patience to listen to the patient and their requirements, and simultaneously actually another important is that AIIMS was started as a national referral hospital. The idea was that anybody is referred from anywhere will be accommodated and taken care. But now it has become a referral as well as a general hospital. So with the result actually there is no capping actually, anybody from any part. So now Government of India has taken a very good initiative of starting AIIMS like institution across the country. No total as on today there will be about 22, which is a good initiative.
It's a wonderful.
But it will take time. AIIMS has taken about more than 60 years to come up to this level.
Great.
Now for other AIIMS it will take time.
Naturally, but I'm sure then once you will have more AIIMS available, then people will be kind of diverted to those hospitals, and probably the workload would decrease here. That's so true.